Alabama, cases of whooping cough are drastically up compared to a year ago, and the Wiregrass is seeing its own cases, particularly with kids.
Area doctors emphasize the importance of vaccinations and that the best way to beat the illness is to not get infected in the first place. WDHN's Robert Smith has the story, all new at 6.
As we enter into another respiratory season, pertussis cases, commonly known as whooping cough, are increasing across the nation and even here in the state of Alabama.
About 10,000 cases a year is what we were seeing pre-pandemic nationwide. Now in Alabama, we range sometimes in the 30s to 40 cases in a year.
Right now, the state is over the average. There are currently 47 cases. That's 41 more cases compared to this time last year.
We have seen a rise and do expect to exceed that before the end of the year.
The Wiregrass is not immune from the highly contagious bacterial respiratory infection. Local pediatricians are seeing a growing number of cases in children.
So recently I've seen probably about a handful of patients with whooping cough. We've had our other clinics in the Dothan Pediatric Healthcare Network also have cases that they've reported as well.
Southeastern Public Health District Administrator Corey Kirkland says the health departments in his 10-county region have also dealt with a handful of cases. As for the two main hospitals, Southeast and Flowers, they have not seen or reported any cases so far.
Again, we may not get all those reports just right away, although we certainly want to get them within a week of the time that the case has been identified. And really, the earlier the case is reported to the health department, especially if we have outbreaks, that's just an opportunity for prevention.
Doctors say with the infection spreading by being in close contact with someone, it can be protected by vaccinations, a message they have stressed for respiratory illnesses at least over the last 4 years to try to avoid respiratory symptoms, hospitalizations, and major complications. They say children, pregnant women, and elderly people could be mostly at risk.
We just absolutely need to reduce the severity of this disease and keep kids out of hospitals.
Reporting Robert Smith, WDHN News for the Wiregrass.